just to introduce myself, I'm Samir Parekh. I'm a professor and a physician scientist at Mount Sinai in New York. And as many of you all may know, New York was the epicenter of the pandemic last year. And at Sinai, we have a very large myeloma patient population. We have 9 physicians that treat over 3,000 patients, and we typically see about 600 new patients a year, with a large number that are enrolled on clinical trials with new therapies, including the latest CAR Ts and bispecifics and so on and so forth. So I was a first responder at the time of the pandemic last year, and we had both cancer and non-cancer patients that we took care of as inpatients, as more than 5,000 patients were treated at the hospital in a span of a couple of months. And what was interesting at that time was that some of our CAR T research came in handy to understand the cytokine storm from COVID, where the setup that we use to analyze cytokines for CRS for after CAR T was actually used by our colleagues from pathology and immunology on several thousand patients, and they found that high levels of certain actionable cytokines like IL-6 were actually prognostic. They were able to distinguish patients that were at higher risk of mortality from COVID-related complications as inpatient. And this is a common theme in our research, where the research we are doing for myeloma sometimes helps us understand COVID and vice versa. So we continued collaborating with the immunologists and virologists, and it was very helpful because in my own clinic, I had a patient who had received CAR T, and based on the recommendations from several organizations, we vaccinated him. And after 2 doses of vaccination, he still managed to get infected with breakthrough infection, came into clinic short of breath and with fever and hypoxia, and was admitted and got intubated and unfortunately died. And this sort of shook us all up and prompted us to study our entire cohort. And thanks to, again, colleagues in pathology and virology, we were able to actually enroll our clinic patients onto a study and compare their antibody responses to healthy individuals. And this led to a paper earlier this year where we looked at about 300 myeloma patients and compared them to healthy controls. And what we found was, after 2 doses of vaccination, in general, the antibody levels of myeloma patients were lower than that of healthy controls. And indeed, even the kinetics of generating these antibodies was very different. Further interesting findings from this study were that there were 2 types of myeloma patients: the patients that had had natural COVID before, who mounted amazing antibody responses comparable to healthy controls, and there were patients who didn't have COVID infection, and those were vast majority of patients, which remained with lower than expected antibody levels as compared to controls. And particularly interesting was that there was a treatment effect. So depending on what treatments the patients are receiving, they had different antibody levels. And in fact, about 15% of the patients didn't develop antibodies at all, particularly the patients that were being treated with monoclonal antibodies against anti-CD38 and BCMA targeting treatments. So these 2 subgroups were particularly enriched for the patients that had no antibody response at all. And since that finding, we've been also trying to understand whether the patients had mounted cellular responses despite not mounting a serological response. And what we found in a subsequent paper that was published in October was that there was a stark difference between patients that mounted antibody responses and patients that didn't, that about 90% of the patients that mounted antibody responses had T cell responses, but only about 30% of the patients that didn't have antibody responses had detectable T cell responses. And when I mean T cell responses, these are responses that are specific for the COVID spike protein. So the way we tested this was by exposing the patient's peripheral blood mononuclear cells to the spike peptides, and then after an incubation, measuring whether the T cells were exhibiting activation markers or expressing cytokines like TNF alpha, IL-2, or gamma interferon. And we found that similar to the antibody study, the patients that were on treatment with anti-CD38 antibodies and anti-BCMA bispecific antibodies particularly had very low to absent T cell responses. This was very concerning, and we then, by this time, the booster had started rolling out, so we encouraged all our patients to get boosted. So at this meeting, we are presenting some early data about the effect of the booster in myeloma. This is yet unpublished. What we found was that the cohort of patients that remained seronegative after 2 doses, if they got a booster, usually the booster was the same in our patients. Majority got Pfizer vaccine and then got Pfizer booster. A smaller group got the Moderna. But about 3/4 of them actually mounted a significant response after the booster, in fact, to a level that is protective as per our virology colleagues at Sinai. And the other finding was that the patients that were seropositive after 2 doses had a further amplification of their response, where their levels increased more than tenfold on average. And this also suggested that the boosters had a helpful effect. So we are really trying to recommend the booster for all our clinic patients, and we are routinely monitoring them for antibodies and wherever possible for cellular responses as well. And furthermore, we are encouraging them to tell their friends and family to get vaccinated as well, so that they have a protective bubble. And especially with the holiday season coming, people want to know if they can meet their family for Thanksgiving, if they can meet their family over Christmas, if they can travel. I think it's important for patients to feel reassured by appropriate protection with vaccines and boosters, as well as testing. And then those that are still vulnerable should, unfortunately, for the moment, still maintain social distancing and remain extremely careful, as we are still seeing infections, breakthrough infections, and COVID infections that are quite severe in the patients that have not completed full vaccination as yet.